Right, okay everyone, I think we will make a start. I suspect there's a few people still trying to shovel their lunch down quickly, but we need to crack on because we're on a schedule. So I want to thank you all very much for attending. This is probably one of the best places I have ever been on a panel from, in the middle of this fantastic livestock market and in the auction ring here. So it's really fantastic. We've got a great panel here, great lineup of vets who've been doing a considerable amount to contribute to animal health over the course of their careers. So I'm firstly going to introduce Christine Middlemiss, who I'm sure many of you will know. She is our chief vet here for the UK. Really interesting history, obviously. Vet from Scotland originally, has a huge amount of experience in both working in the field as a vet, also as part of the civil service. I was very interested to see that you were also chief vet in New South Wales in Australia for 2 years before coming back to the UK and being our chief vet here for, since 2018. So yeah, fantastic history there. Then we've got Sarah Tomlinson, who, another person who has been doing a lot of vetting, mainly to the north in Derbyshire for the last 21 years, working for a number of vets, including West Point Farm Vets, but also has recently moved to Kingsay. But Sarah is also one of the board members of the National Beef Association, and she is part of TBAS, the TB Advisory Service, which is based in England. So looking forward to an insight on that. And then we've got Kath Aplin, then to my right. Kath is a graduate from Liverpool University. She has done a large amount of vetting, both down in the south, as far south as Somerset, but then also up in the north in Cumbria, and has since moved on to Boehringer, where she is the Ruminant Veterinary Advisor, and doing a huge amount of work, not just in diseases such as PVD, but also in various amounts of animal health research, including recently cattle inflammation and what can be done there. So there's a huge range of skills here, a huge range of knowledge. I suspect we will be largely talking about disease, but I think it's fair to say that we can throw this open generally. I mean, animal health is so many different things to so many different people on different farms. So there's going to be a lot to talk about. I'm going to hand over to Christine first. So yeah, take it away.
Great, thank you very much, Abby. Thanks for inviting me here today to speak, and it's really great to be on this excellent panel and lineup, just showing how diverse animal health and welfare now is. I've also been here in kind of caretaker mode today because I had an instruction to visit the Lings stand where my cousin has donated some cattle to show, and I can report back that they're looking happy. So I'm going to talk today about the importance of electronic identification and traceability for industry, and about the livestock information service that we are rolling out in England and how it will positively impact on endemic disease control. People generally think of identification and traceability often as a kind of burden, as an administrative burden, a tool, a regulation that has to be met, but not really clear on the impact, the positive impact that it has about helping us control disease. And that's why we started out with cattle identification and traceability on the back of BSE developing, so that we could uniquely and individually identify every cow, each cattle, and their offspring and their cohorts that we need to trace when we confirm a case of BSE. So that's where it started out. For sheep, it started out in the aftermath of 2001, where lots of sheep moved, and we needed and moved through a number of different farms or markets, and we needed to be able to identify what those tracings were. So identification and traceability for me is I'm not just really important, it is an absolutely necessary disease identification, control and management tool. Much like epidemiology that we've heard about in coronavirus, understanding where disease came from and where it's gone to and why it was here in this farm or hospital, wherever you're talking about animals or humans, why is it here today? It's exactly the same principles of being able to understand where animals have been, where they are now, what other animals they've been in contact with, because if you have a foot and mouth suspect, even if we have one that I'm really worried about, we will start tracing and thinking about all those contact animals right from the very beginning. And the longer it takes you to follow up all the contact animals, the longer it will take you to get on top of disease outbreaks. So it's really, really important. And it's really important that we have the tools, not just to do it accurately, but we can do it quickly. And that's why I'm so in favour of EID, because it will really help us have accurate recording, numbers in databases, not just all bits of paper in people's, in your movement books and things, but on databases that we can access quickly with accurate numbers. I know I tend to be a bit number dyslexic, and writing numbers down correctly every time is not a great skill of mine. Having it done electronically is fantastic. So we see real benefits for that. But it's not just about foot and mouth disease. Sarah's going to talk about, and we live with all the time, TB, and again, really important that we can identify each animal individually, where it's been, has it been in contact with other infected animals, and work out all those links. And we use it in food safety incidents as well. So E. coli 157 outbreaks, for example, will be followed up in individual animals. When I confirmed the BSE case at the end of last year, we rapidly followed up all the cohorts of that animal, and there were quite a number, tens of them, and the offspring of that animal, to confirm to trade partners. And the Philippines stopped our beef exports for a while until I was able to confirm that we had followed up and dealt with every single animal related to that confirmed case. And so for trade partners, it's important not just in disease outbreaks, but that you have a functioning system. It's like a positive assurance, so that they know if they get beef from us, whether it's in a steak, whether they're getting a container full of carcasses, that we can trace, if necessary, that all the way back to the farm of origin. So it's not just about having it there as an insurance policy. Having a quick, effective, accurate identification and traceability absolutely underpins all the trade with the rest of the world. And people won't want to trade with us if we don't have a system that can do that. As I said, it's really important to know just where an animal is accurately, the right keeper details, because if we've got a confirmation, we need to be able to contact that person urgently and say, don't move your animal. At the moment, we're really worried it might have been in contact with something infected. Keep it where it is till we come and look at it. And as I said, we need to know what other animals it's been to, the epidemiological group it's been in. And that's really important if animals have left farm, been in a wagon, come to market, sold on, maybe gone somewhere for an interim period, following all the way through that chain, all those contacts. Because much like we saw with coronavirus, sometimes animals will have disease and they actually still look pretty healthy. You wouldn't know there was anything wrong with them. It's finding the one that is infected and then following, like we had contact tracing and through electronic ID and electronic systems. We're comfortable that our electronic tracing would be pretty good in an outbreak, but we're always looking to make it better. We'd be able to follow all those animals back through the chain. The use of electronic ID is growing throughout the world, and we don't want to be left behind. Paraguay, Uruguay, for example, in South America, they're quite well ahead of the game in using electronic identification and actually linking that information then into carcass data and things, because they are very focused on trade with the rest of the world. In Scotland, they're pretty advanced in their plans for electronic identification in cattle. As we know, we don't have these formal borders in Great Britain. Animals move. Scotland, grow on in England, may be slaughtered in Wales. It's important that we, to me and all the other chief vets, that we have a system that works on a GB basis, so that there's not extra administration for people who are moving animals in that way. It's just part of your normal daily life, but we can still follow them as necessary when we need to do. Really aware of the admin burden that keeping records has for people. And previously we've had, if you've kept cattle and sheep and maybe had a few pigs, you've had to interact with different systems for all of those. And we need to make it easier for people to do that. You know, one portal to go in and record the information, not interacting with 3 different systems in 3 different ways. So we're really keen that we focus on making it easy, the stuff you need to do every day. And they're, as far as possible, aligning cattle EID with sheep. Now, there is a question about that, and we'll be coming out to consultation to everybody on EID in England shortly. And one of the questions is, what frequency tags do we use? Scotland, pretty much going down the line of high frequency. We know we've got low frequency in sheep. So is it better to have a system that works across the whole of the GB cattle sector? Or do people have a preference for having, if you've got low frequency sheep tags, also using on your farm low frequency cattle tags? There's already some admin burden for us around that, because we need to change the IT and some of the underpinning health IT systems in terms of the numbers, the ID numbers for cattle between between low frequency and high frequency. There are a different number of digits, so that makes life extra complicated. No decisions are obviously made because we want people's views. We want to know from industry what is the best way to do it and work it for all of you. EID health and safety benefits. We all know when you're TB testing or blood sampling and you're writing down those individual numbers, you know, you've got a cow that's upset, her head's going up and down, it's not easy. Electronic identification and being able to read it and download it will be much better. And I'm very keen that we link and use the EID as a basis to then gather animal health information. Now, this is not for me as government to look at, this is for individual farmers or industry. But one of the things we see with endemic diseases, the ones that government doesn't control, is that we're never really able to say what disease level we have, because that information isn't collated in one place. Farmer might know his status, their vet might know the status, the lab that they sent those samples to, but there's no actual national collection of that information to say, actually, have we got a problem here? And so when industry come and say, oh, we'd really like to have a uni scheme or a scheme to do such and such, and we go to Treasury and we think, this is quite a good idea, Treasury, we'd like some money to do it, and they say, give us the evidence. Give us the financial evidence as a problem. And we can't actually do that for the non-statutory diseases because we don't have all the information in one place. And EID, as I say, it's not about government having access to that information. It's about all of us having it there so that when we need to understand cost-benefit, different actions that will be effective, we've got that evidence base to do it. So as I said, England will seek to consult on our approach, and we absolutely do want to make it something that is easy, works for you on a daily basis, and is not the burden of, oh gosh, I've got to go and fill in all those records and things because somebody's coming to inspect me. It's got to be easy and as real time as possible. There will be lots of advance warning, lots of communications as always about it, and we need to make them, I know, as easy to get through and understand what's being required as possible. We're not always very brilliant at that in government, making things, you know, we tend to get stuck sometimes in a bit of government speak, so we need to make that easy and simple. And of course we need to think about when we introduce it, because the last thing you need is it to be introduced when you're busy calving and in your peak of spring work, for example. Another initiative we're underway with and have rolled out in sheep already is the Livestock Information Service. So as I said, historically we've worked with different database for sheep and a different database for cattle, and indeed a different database for pigs. We're looking to bring them all together. It won't be one mega database, it may still be separate ones, but ones that we all interact with as though it's one unit, so that the core processes, completion of you know, putting in your information, us pulling it out, it's all one system, which for me in a disease outbreak will be much quicker and slicker. And I hope for you inputting information would be much quicker and slicker as well. It'll reduce duplication, and it absolutely will reduce the potential for errors. You know, it gets, if you're looking at, say, one farm in an outbreak and they've moved cattle and sheep and you've got errors in the CPH number and things written down, can take quite a long time and a lot of admin to go through and work out where the mistake is. Meanwhile, you can have disease moving around. So it's important that we do what we can to reduce those errors. I'm very much making this with the Livestock Information Service, and we've worked a lot with industry through TDUG, which is the Traceability Design User Group, chaired by John Cross. MBA are on it, LA, Chris Dodds is on it, a number of people to tell us about what actually will work for industry and, importantly, what won't work. And we've been designing it hand in hand because we believe that that statutory data that we will hold at base level can be built on by industry, as I said, so that you could have your disease information that only you can see, you could have carcass confirmation, you could have genetic information, and you could choose to share it with who you want. But it would mean that that core data, that animal and that farm, we're all talking about the same one. And for me, I can imagine a time when, you're going to China talking about beef exports from the UK, and you can talk about that consignment, that abattoir that it went through, the various different farms, and you can look at, you can see the information and the assurance of what's going on brigaded in that different way. And I think that would be really, really powerful. So we've rolled out the sheep part of it earlier this year in March. It's gone actually really smoothly for rolling out a new database, and we've had really good feedback from industry. I'm really pleased with it because it has dramatically reduced the number of errors in the system, the quality of the data. People forget sometimes, you just think it's about having the data in one place. There's not much value in that if the data, the information in it is not good quality. The quality of it is greatly improved. So as I said, we're looking at bringing it, having access together across all the species. So we have this multi-species rules engine, is what the IT people call it, but it will give us, as I say, better cleansed data, avoiding duplication and avoiding errors. I talked about how we can link it to animal health information. The animal health and welfare pathway in England is beginning to roll out. We're going through an initial pilot phase with 60 farms. And this is the new version of what was the rural development programmes under when we were a member state, a member of the EU. What we're able to do, now we're not part of that scheme, is take away some of the prescriptiveness. So the previous schemes were very much about bums and seats, going to training, hard to make people really see what it meant on farm and what benefits you could get. The first thing we're offering is vet visits from your vet, whoever you choose, to look at the health and welfare on your farm. The things that maybe have been in the back of your head bothering you, but you've just never had the time to sit down with your vet and talk them through. So whatever you choose to talk about, we're going to fund for the vet and the farmer 2 hours of time to make that happen, and that will be on an annual basis for 3 years. We'll also ask that BVD testing is carried out for those farms that haven't already been in one of the BVD schemes, so that we can really roll out BVD control to all farmers who have previously received single farm payment for it. It's not statutory, it won't be, but all previous receivers of single farm payment will be eligible to receive this funding for it. We'll be giving the money to farmers on receipt of they've had their vet out and things, and we'll be able to start collating that information. For me to be able to say again, when we're talking to trade partners, every farm has had a vet visit. Some farms have lots of vet visits, but some farms have very few. That every farm in England has had one of these, again, would be a really powerful thing to do. We'll be backing the vet visits up with capital grants, so the bits of equipment and things that will help you potentially manage the issue, take forward the issue that you and your vet discussed. And there will be further series of those rolling out later. So we're starting with 60 farms as a pilot over the summer, and then it'll be ramping up in the autumn until it's rolled out fully to all potential single farm payment claimants. So as I said, we can't introduce bovine electronic identification without understanding what you need from it. So really encourage people either to engage directly with a consultation or through MBA, NFU, whichever stakeholder, whichever organisation you're a member of and go, but it's really, really important, as I said, it works for you in the ground. We're already been doing a small amount of work with this and stakeholders so that we can develop our thinking, but we'll be ramping this up from June. And there will be, as there always has to be for government when you're undertaking new legislation and action like this, a full consultation which we expect to roll out in the autumn. And I'll finish there. Happy to take any questions now or at the end, however you want to do it, Abby. Thanks.
Okay, thank you very much for that. Yeah, we'll take some questions at the end when we've heard from all the speakers, but really good introduction there to learn about the value of data and what you can do with it to control animal health, not just on your farm, but within your county and obviously within your country and then across the 4 nations. So we'll go on to Sarah next, who is going to go on to the very light-hearted topic of TB.
Thank you. So my name's Sarah Tomlinson. I am predominantly a farm vet. I've worked for 21 years in Derbyshire, and I'm really lucky to have a really great relationship with the farmers I work with. And that's kind of how I got into knowing more about bovine TB, because I understand the impacts, the emotional impacts and the financial impacts that TB has on farm businesses and the people that work in those farm businesses. I appreciate there's politics, there's a lot of controversy over some of the control measures that we use, but today I want to kind of park that out of the room and actually focus on TB as an infectious endemic disease of Great Britain. And to me, trying to engage farmers in wanting to do proactive things about it, outwith of government policy, because actually it does impact your productivity and your sustainability, which is kind of the whole theme of today's Beef Expo. So it is an endemic disease, it's an infectious bacterial disease, just like we've got Yonis on farm, and we have the viral diseases like BVD, which Kath will be talking about, and all of those impact your productivity. And that impacts your profitability and your sustainability. And for TB, it's not actually just the infectious disease, it's the way we manage our farms just in case of TB. So how many farmers don't send cull cows to slaughter until the week before their TB test, just in case they get a slaughterhouse case? That's not good farming. How many people serve their cattle in a certain way, or they keep replacements, or they sell replacements because of TB, just in case you have a breakdown? You keep slightly lame cows, Yonis positive cows, cows that have aborted because you need the numbers, because you've lost reactors on a TB test. That is not good farming. Wouldn't it be great if we could make decisions on farms based on good farming practice and not based on TB? So the question I sort of say to farmers, and we pose to people through the TB advisory service, is, are you fed up of playing that TB lottery? And actually, let's take some control back. And just like every other infectious disease, there are risk pathways that TB can get onto your farm and can recycle on farm that you can control or even eliminate in certain situations. So to put it into context, the government announced a 25-year eradication strategy in 2013. We had a 5-year review of that strategy, and then the government made a response to that, and these 5 outcomes were sort of published. So outcome 1 is talking about a deployable cattle vaccination programme, which I'm not going to cover here because that could be another whole 20 minutes, but I'm quite happy to talk about it afterwards, and I'm sure Christine is. Evolving the strategy for preventing TB from wildlife, again, would be probably the whole afternoon taken up, so I'm not going to cover that. Looking at the diagnostic, surveillance and epidemiology, again, a whole hour subject. But what I'm going to talk about is this incentivising industry behaviours to change how we purchase animals and how we improve the biosecurity to decrease that cattle and badger interaction. And then the 5th one is improving the governance, which, again, we're working on. So I keep talking about the TB advisory service. Who are we? We are a very small team that are delivering a DEFRA-funded project, and it's to give free, bespoke TB biosecurity advice to you guys on farm. And hopefully it's your own private vet that can come and deliver that advice. And it's available for all farmers now across the whole of England. It previously was only the high risk and edge area, and it's for all farmed TB susceptible species. So previously it was only for cattle farmers. Now it's goats, camelids, pigs, sheep, farmed deer. Have I forgotten anyone? So if you've got neighbours that you think might be a risk to you because they have pigs that are outdoors, or they've got camelids, or they've got farmed deer, encourage them to have these TBAS visits, because this is kind of a community effort. We can reduce the risk generally in areas. So going back to TB as an infectious disease, I think farmers and vets have really good relationships, and I think Kath will talk a little bit about how we manage BVD at managing infectious disease on farm. You know, we screen for Neospora, we manage positives differently, we might breed them differently, and we put a plan in place. For BVD, we do one type of maybe initial screening, we might do antibiotic screening, then we might say, okay, we've identified some level of disease, we need to move on to a different test to look for different parts of the immune system, or look for the virus, to look for PIs. We make a plan. We look at the test results, we think, what do we need to do to reduce it, eliminate it, and to stop it coming back in again? Yonis, exactly the same. We do a lot of routine surveillance now. We do maybe further tests, so fecal sampling. We cull positives out of our herd because we know that they could be spreading disease. Why is TB any different? And I know it is because of the impacts on your business when you get breakdowns and the inability to trade. But actually, we can be thinking like TB on our farms. We have a free TB surveillance test, different schedules depending on your risk area. We might have to do more tests to identify the extent of the disease. We might have to do a different test to look for slightly different parts of the immune system. And the government says you have to cull your positives. And actually, you get compensation for those positives. BVD, Yonis positives, you know, I'm telling you as your vet, you need to cull them, and you do that at your own expense because you know the impact that those animals have on your productivity and sustainability, and TB is no different. So TBAS will come onto farm, free visit, and what are the risk factors that we are looking at? So we look at your farm TB unit history. We know how recently you've had a TB breakdown means you're more likely to get a TB breakdown. We look at your local geographical area, so hopefully in Darlington you're a lot less likely to get TB than you are if you live in Derbyshire, say where I am. We look at the risk of TB coming onto the farm through infected stock. Just like Yonis and Christine said, animals can look perfectly fit and healthy but can be harbouring infection. We look at the risks at pasture, so that isn't just badgers, but what risks are your neighbours. Looking at the farmyard risk, what risks are badgers coming into the yard, and also visitors and shared equipment. We know TB can be spread through slurry and muck. And then finally, we look at the farm business. And this, for farmers that have never had TB, this is the bit they actually find most rewarding from the visit, because we look at what impacts would a TB breakdown have on your farm business. You wouldn't be able to sell anything. You can't buy on for the first 60 days till you do your short interval test. And so there's lots of things that massively impact your business. So we talk about which policies there are out there that actually we could implement before a breakdown that could help your business be less affected by that TB breakdown. So I've got two take-home messages. One is we really need to understand the skin test. It gets a lot of bad press from both sides of the kind of argument. So there's two parameters for any scientific test, a specificity and a sensitivity. And again, I think we've talked a little bit about this through COVID, so people are more comfortable talking about it. The specificity is how confident we are an animal is truly infected. And the specificity of the skin test is 99.98%. And as scientific tests go, that's pretty good. That's why we're still using it after lots of decades. So we know a skin test reactor is 99.98% infected with TB. We have to trust the skin test. And the reason we use this skin test is because the consequences of finding a reactor are so severe on your business, we need to be really certain that we're putting those things in place because we need to. What the TB skin test doesn't tell us is how diseased that animal is. So that's when the animal goes to slaughter and it comes back and you get the good news, I think, that they have no visible lesions. That means that infection hasn't progressed to disease in that animal. And actually, if you get a visible lesion or a culture positive, that's probably more infectious and has bigger implications for the rest of the herd. And if you think about it, every TB reactor goes onto a commercial slaughter line, and the whole process of meat hygiene is to look for TB within that lung tissue. The lung tissue gets felt for lumps and gets cut into. So if you've got lesions the size of marbles, they're going to be missed, probably. Whereas if you've got a tennis ball, which has probably taken quite a long time to reach that size, it's going to be found. So actually, probably most NVL cattle will have some small lesions somewhere. So we have to trust that test. The downside of the skin test is its sensitivity, and this is the probability of correctly identifying all the positive animals. And the skin test, on a good day, if the test is done correctly, is about 80%. So realistically, that means 1 in 5 infected animals can be missed. So this is really, really important for when you're buying animals in, or you're looking at the infection status of your herd, because there will be lots of herds that become officially TB-free because they pass a skin test, but because of a long-standing history of TB, they might not be infection-free. So that's why the longer a herd has been testing clear of TB, the more you can trust that test is genuinely clear. I'm not saying people shouldn't buy from farms that have just come off TB restrictions or have had TB recently, because it might be you're in that situation too. And actually that herd is BVD free or Yonis free, and that's what's important to you. But I want everybody to understand the science behind the test so they can make the best decisions they can for their business. And if you're buying in calves for finishing, actually let's manage those riskier ones in a less risky way. So we put them in a badger-proof shed and we don't mix them with, say, the suckler herd on the farm. My other take-home message, I am going to mention badgers. Badgers do give cattle TB and cattle can give badgers TB. So actually reducing the chance of that happening by stopping them have indirect and direct contact is really important. So TB can live for up to 60 days in a water trough, and badgers can get through a gap of 7.5 centimetres. So look round your farm and see if there's ways that actually you can reduce the risk of that badger getting into your water trough. Badgers can't get into troughs about 1 metre high. So if you can, raise your water troughs and go through and look at your feed stores, access into calf sheds, and just block off those gaps under gates. If you're replacing gates by sheeted gates, none of this is rocket science, but what TBAS can help you do is just identify those areas that you can manage on farm. Because if you've got an infected badger sharing your water trough, there's a potential source of infection there for 60 days. Raising that water trough to 1 metre high will eliminate that risk pathway. And then finally, looking at what parts of your business could be disrupted. So is it your reputation? You know, we've got some amazing pedigree cattle out there. If you had a TB breakdown, and we're encouraging people to look at TB risk alongside other infectious disease, what can you do to protect your reputation? And the Czechs health schemes now have a TB accreditation. Is it selling store cattle? You know, your rent's due, you sell your store cattle to pay your rent for the next year, and all of a sudden you have a TB breakdown. What's going to happen to your cash flow? Are you better keeping those cattle, fattening them yourself? Have you got the resources, the staff, the feed, the bedding to do that? Or are you better selling into a local AFU or selling through an orange market? And actually, the sort of tradition is people worry about selling into those outlets because they think they'll get a reduced price. If you've got good cattle, those guys are on a contract and want good cattle to go into their finishing sheds. And then looking at if you're buying in, actually you can't buy in for the first 60 days. So your output at the other end will be reduced. So it's looking at that and thinking how there are ways you can mitigate it. Could you become an AFU so you don't have to do any statutory testing? And then looking at the loss of income and weighing up, like I said, is it better to sell those cattle on now into a different route, or are you better finishing them yourselves? And that's me.
Okay, thanks very much, Sarah. it's fair to say that TB is a bit of a minefield, and I think those of us who have been affected or dread having that coming onto our farm, sometimes it can lead you into depths of despair, and it's good to know that there are services out there like TBAS that can help you put things into perspective and at least try and feel like you've got a bit of control. So we're now going to pass on to our final speaker, who is Kath, who's going to move on to BVD. And I guess this all ties in. I mean, we've already had our chief vet now talk about the value of data and how you can help protect yourself or see what's going on your farm. And Sarah's honed in then on a specific disease, TB. But there are other diseases out there that can compromise animal health, and quite often all can be linked. So over to you.
Okay, great. Thank you, Abby. And thanks, Sarah and Christine. So yeah, I'm going to talk about BVD. I feel like it's slightly depressing in a way, just focusing on diseases and all the things that can go wrong with your cattle. But hopefully, with a bit of focus on what could go wrong, it will trigger some preventative action, so then we can focus on having more healthy cattle. That's the plan. So yeah, BVD. I think we can all agree that life would be better without BVD. It's whether you're as an individual farmer or as a beef industry, we know it's a drain on the health of cattle and a drain on the profitability of our herds. So yeah, we'd be definitely better off without it. And the good thing is, we can eradicate it. We do know how to eradicate it. And I've got the easy job here. It's way easier than eradicating TB. A lot of farmers in the room will have already eradicated BVD from their own herds. And we know several countries have already eradicated it on a national basis. Ireland's well on the way. Scotland's well on the way as well. So we know in England and Wales, we can do it as well. But nationally, it is still a problem. And in a way, that's quite surprising. I feel like I've been banging on about TB for decades, not TB, that as well, BVD, for decades, really. And we've been talking about controlling it on individual farms for a long time. Yet, when we test for BVD out on farms, we are still finding it. We're still coming across herds where it's just grumbling in the background there as an endemic problem, just eating away at health and profitability. And we also still come across farms that have been BVD for a long time and then have a catastrophic breakdown. So it's definitely still out there, it's still a problem. So I think those reasons are one of the reasons that BVD is a priority for the animal health and welfare pathway that Christine mentioned earlier, because we know we can get rid of it. It is an achievable thing to do. So I wanted to talk about how suckler farmers, how beef farmers in general, can make the most of the annual annual health and welfare review that Christine mentioned, this funded review where beef farmers are going to get £522 towards sitting down with their vet, talking about diseases such as BVD and including some BVD testing as well. So yeah, just the practical steps about what you should be speaking with your vets about on your own farms. I would imagine that most of the farmers in this room probably do already know their BVD status. I'm guessing you're kind of the more proactive people. But if there is anyone there who doesn't know their BVD status at the moment, it's a pretty straightforward thing to do with your vet at this visit. Firstly, work out with your vet which are the best tests for you to do on your farm to find out what your BVD status currently is. If you find some of those tests are positive and you've got PIs, persistently infected cattle on your farm, get rid of those PIs, and then you are on your way to becoming a BVD-free herd. The key thing is with BVD control is not to stop there. If you found you haven't got a current BVD infection on your farm, or you've you managed to remove the infected cattle from your farm, it's making a plan to protect your herd and keep BVD out. I think a lot of people in this room might already be BVD free and thinking, yeah, I'm free of BVD, I may be checks accredited, already testing regularly to make sure I haven't got BVD on my farm. I'm quite happy I've got BVD sorted. And that's great. A lot of those people probably have, but I do think this annual health and welfare review is a really good opportunity just to sit down with your vet and say, have I got all the gaps covered here? Am I confident that I am going to stay free of BVD? I think experience from some of the other countries where they're well on the way to eradicating BVD, Scotland for example, is that some of the herds that are testing positive now are not necessarily those kind of bad apples who haven't really engaged with the programme. I think most people are on board with it now as the scheme in Scotland has gradually sort of become stricter and more people have made sure they've got rid of BVD on their farm. What's happening now is those good farmers who've had BVD well under control for some time and think they've got it sorted, there's just been some little slip up somewhere. There's been a gap in the biosecurity they hadn't thought about. Maybe some circumstances have changed and BVD has just snuck in there. And it does have a habit of doing that, BVD. So this is a really good opportunity just to make sure that your BVD control plan is properly watertight. So, yeah, there's sort of, I think, I'll just go back to those four points, really, that I think you ought to include in a BVD review if you're already BVD free. First one is to review your biosecurity and check where there might be any gaps where BVD might find its way in. And this really is very similar to the sort of stuff that Sarah was talking about. And there is, although the two diseases are different, and we obviously don't have the badger complication in BVD control, there's a lot of similarities as well. So when you're looking at your biosecurity of your herd, you might be focused on BVD in this situation, but you're going to have an impact on other diseases as well. If you're vaccinating for BVD, reviewing your vaccine protocol, just again, you want to just to make sure that is watertight as well. It's such a shame when we hear about people who've been vaccinating their herd, but perhaps just this year they didn't get around to vaccinating their heifers before they put the bull in with them, and then the heifers went away to a neighbouring field where there were some PIs in contact. Just things like that, where something just slipped slightly, and that meant that BVD found its way in. So reviewing your protocol to make sure that's watertight. And then also testing. Another experience from Scotland, I feel, was that initially when people started doing their annual check tests that a lot of you will be familiar with doing, testing a group of animals, a representative group of animals to see if they've got antibodies to BVD. That's a test, it's really important to make sure you're doing that test right, to make sure you're testing a representative group of animals. The last thing you want is to have not quite done that test properly. Maybe you tested, one shed, but missed cattle from another shed. Find that you've actually missed a source of infection, potentially a PI animal in one group there, and you don't discover that until much later on when that animal started to sort of wreak havoc amongst your herd. And then finally, making sure that you're registered with an accredited scheme so that you basically get the benefit in terms of other people knowing that you're BVD free in terms of trade. So I'll just go into each of those four things in a little bit more detail here. I quite often put this up. This is a resource that we share at Boehringer, a biosecurity checklist. There's two words that are designed to sort of put farmers off. It's the words biosecurity and checklist. It's not everybody's favourite thing, but I really do feel this is a valuable type of process to go through sitting down with your vet, looking at the various ways that BVD could come onto your farm and whether how much of a risk those things are on your farm and whether you've got plans in place to mitigate those risks. Now, when we're talking about biosecurity on beef farms, I think it's really important not to kind of beat ourselves up for not having like 100% secure biosecurity. We're not high security pig farms. Beef farms are never going to be 100% biosecure. There are usually going to be people going to and fro. You might be buying in cattle. But the key thing is to know what your risks are and manage those risks accordingly. And these risks on this slide here are kind of written in approximately in order of how important they are in relation to BVD coming onto your farm. So if you're buying in cattle, that's clearly that's the easiest way to bring BVD onto your farm, if you like, is buying in cattle. But that's not to say you can't manage that risk through testing and isolating incoming cattle. If we go right down to towards the bottom of the list, you know, things like sharing equipment or maybe people going to and from your farm, those are much lower down the risk stakes, if you like, but they are still a risk. So it's worth thinking, you know, if you're a herd that buys in, then you know you've got those risks there that you need to manage. But if you're a closed herd, you can't just stop there and think, oh, I'm a closed herd, there's no chance of BVD coming onto my farm. Very few farms are totally closed in terms of people and other risks. Going to shows, this sort of thing. So, yeah, sitting down with your vet, working out what the risks are on your farm and having some kind of plan in place for reducing those risks where possible. However, there's going to be some risks potentially that you can't, they just are there and you know you can't completely eradicate. So that is where vaccination comes in. So that's one of the big things that makes, I suppose, BVD control that bit easier than some other diseases is that we don't just have to rely on biosecurity, that we have got the benefits of vaccination as well. We can protect the cattle through vaccination. As I was saying earlier, though, the key thing with vaccination is such a shame if you don't want to spend the money and your time on vaccinating cattle if you're not certain it's going to be 100% effective. So the important thing, I think, to understand with vaccinating against BVD is there's a specific thing that you're trying to achieve with vaccinating for BVD, and that is to protect pregnant cattle against producing PI calves. And that's a really specific thing. A lot of other vaccines, say calf pneumonia vaccination, you're having more of a general dampening down effect on the level of disease on the farm. With BVD, the key thing is those pregnant cattle, protecting them so they don't produce PI calves. So key thing there with vaccinating against BVD is making sure that every animal that's going to, every breeding animal on the farm is protected before she gets in calf, so she's protected for the duration of her pregnancy. Yeah, that sounds very straightforward. I think as a vet in practice, I've maybe been slightly guilty of saying, okay, yeah, you should vaccinate against BVD. There you go, there's your vaccine, get on with it kind of thing. And in practice, it can be much harder when if you're buying cattle in, you've got different groups of heifers coming through at different times. You maybe don't want to be vaccinating during the summer when they're all out. You've got to do it at a practical time of year. So all those things have to be taken into account to make sure that you've got a system in place that's watertight, that's robust, that means that you get everything vaccinated at the right time and things don't slip through the net. And then obviously the obvious message also about making sure it's looked after properly, the cold chain is maintained, and that vaccine is properly effective when you put it into the cattle. And then the other thing I was talking about was making sure that your testing protocols are robust as well. That if you are going to the effort of testing for BVD, hopefully joining up with a scheme to show that you're BVD free, you want to make sure that your testing regime is robust as well. The nice thing about BVD testing is that we've got some really reliable tests. The sensitivity and specificity that Sarah was talking about are very high in tests with BVD, so we can be quite confident in the results. And we've got a choice of different ways of testing as well. A lot of you will be familiar with tissue tagging baby calves or testing groups of older cattle for antibodies. But again, those tests are only as good as the animals you select for testing and the way that they're used. So with tissue tagging, the key thing is to make sure that every single calf is tagged. If you miss one animal, that animal could be the one PI that slips through the net. Every single calf, whether it's born dead or alive, if you've had an aborted calf, that could be the PI that's a sign that you've got a breakdown in your BVD status. So making sure that you've got a status for every single animal. And as I was saying about the young stock check test for antibodies, with that test, you're testing just a small group of animals as kind of sentinels for whether there's infection on the farm. So it's really important that you sit down with your vet and check that you are testing a representative group of animals. The idea is to test a group of animals out of every management group, and it's kind of working out what is the definition of a management group on your farm. If anyone here is a non-breeding herd, if you're rearing or buying stores, if if breeding and breeding herds start to become if more breeding herds become BVD free, that's great news for you guys, because it means there's a less and less chance of you buying in a PI when you're buying in stock to fatten. And the key thing really for you guys is make sure that you buy BVD free stock. So that's either buying from herds that are accredited BVD free or testing them ideally before they come onto your farm. So yeah, that's it from me on the BVD front. I think the annual health and welfare review, the funded vet visit, is a really great opportunity for us as an industry to finally get properly on top of BVD on our farms and make the most of that opportunity now so that you can have a really robust status while that funding is available. Thank you very much.
Thanks very much, Kath. It's always good to look at BVD because there's so many complex diseases out there for cattle, and we tend to feel that this is one of the ones that we can really grasp. And I was really lucky, because Kath's here from Boehringer, Ingelheim. I was really lucky a few years ago to be funded by Welsh Government to travel out to Germany to look at BVD. And they've more or less eradicated it. And they've got 9 countries on their border. And we're an island, and we're trailing behind. So, I think there's so much that we can do, and it's a real opportunity for us to try and improve the overall health of our herds. So we're going to offer out 2 questions to see if anybody has got anything they'd like to ask. Please feel free, if we haven't mentioned anything up here, please feel free to open up the topics even wider. Yeah.
Thank you for your presentations. 2 questions really, to Christine, please. How many false negatives are there on the BVD test? I spoke to a farmer this week who believed that was in Northern Ireland, who some cattle have slipped through the net. He thought he was buying a negative, and it turned out to be a positive. He ended up with PIs on his farm. So I just wonder what the accuracy is. Are there official figures on the BVD test? Because they're mandatory tag and testing in Northern Ireland. And will England ever have mandatory tag and testing and catch up with the rest of the UK?
Okay. BVD not statutory, I'm not up to speed on the specificity of the test, so I'm going to pass that one to Kate for that.
So sorry, I couldn't hear you very well actually. You were saying that a farmer had tested a tissue
false
tag
negative result on a BVD test, yeah.
on a tissue tag.
Not on a tissue. On cattle he was buying in, they'd done a tissue tag and test, and they were sold as BVD negative, BVD free, but he ended up with a BVD breakdown on his farm. So
Yes.
nothing's 100%. Perfect.
Yeah, that's right.
But how perfect is it, or how good is it?
I don't have the specific figures for the sensitivity and specificity of the ear-notch test, and there are a couple of different types of tests as well that can be done. There's PCR and there's antigen ELISA, and they have different sensitivities themselves. But I would say that the tissue tag test is a very good test. It's very unlikely that you'll get a false negative result, but it can occasionally happen, so you can't completely rule it out, which is why if I'm advising people, if they're buying in cattle, that if you buy the most robust thing to do is to buy from a BVD negative herd, a herd that's checks accredited as BV negative, and you've got an individual status for that animal as well. And that's a little bit like what Sarah was saying about the TB test, that if you buy from a herd that's had a TB negative status for several years, then you can be more confident in that test result. And the same sort of thing for BVD, really. If you've got an accredited negative herd and an individual animal status, then you can be pretty confident in the result. The other option, of course, is always to test the animals again on arrival, onto your farm, if you want to be belt and braces about it.
And the second bit was about mandatory testing tag and testing for England. When will we catch up with the rest of the UK?
So I will pick up that one. I hope following the pathway and the information we get out of that in the first year or 2 years, then that will give us the basis to persuade Treasury and other people that there is a case that we can crack it, we can get the benefits by making it mandatory. So we've got so many people started already. We know we have to have everybody take part to get 100% eradication, or everyone taking part, that we need some legislation to get there. But that's what I was saying about having the evidence and gathering that information in one data system so we can access it and actually have that evidence to say, look, we've got this far, legislation will help us get to the end of it. After consultation, of course, but industry generally, when we speak, say, we would like a statutory scheme ultimately so we can eradicate.
Thank you.
Can I just come in quickly on that? Because this is where looking at TB in the context of other infectious diseases, we already have that legislation and compulsory testing for TB, which actually upsets quite a lot of farmers to have to do it. And yet actually for things like BVD and potentially Yonis, we might be asking for that legislation. So it's looking at TB in perspective, that it isn't all bad, this government testing, because actually at least we do have some control over that endemic disease.
Yeah, because it's the only way we can make 100% of people take part, and that's what you need if you're going to get to eradication.
Thanks for your question. Ben.
A couple for Christine, if I can, please. Firstly, I was lucky enough, I'm going to guess probably about 4 years ago, to have a few meetings with Simon Hall, who was utterly brilliant. And at those meetings, we saw roll out a programme of how quickly the livestock LIS was going to come on board, and there was a beta testing phase, and there was an application. And anyway, we're about 2 years behind where I thought we should have been, from my understanding of those meetings, and I can't see any sign of it sort of around the corner either. So how far behind are we at updating BCMS?
I'm going to give you a timeline on, not just say, yes, it's going to happen, but I don't have it. So we're rewriting the business case, basically, because we're behind and we spent more money getting to where we were than we intended. We have to rewrite the business case so that we will still get that ongoing funding. Confident that that will happen, particularly on the back of what we've done with sheep and the improved quality, but it's a burdensome admin process to have to go back through with it. One of the things that Simon and the team's fantastic work has done is unearthed all the googlies, the things that weren't quite right in the systems we've had already. To have, so APHA use the data, RPA have the systems. It's not a very slick way of doing it, and for me, pulling together a disease control system and saying, yeah, it all works. And so we found out lots of things in the system that are not right and not perfect. And so part of the journey in a prolonged time is working through those as well. And that brings out the question of, well, do we need paper passports in future? How do you transfer them from the current system without creating, as smoothly as possible into a paperless system? There's all these questions kind of around the edge of it that come out that have got to be addressed. But we as DEFRA and Secretary of State remain firmly committed to do it, but we are having to go back through some of those admin business case kind of things to constantly prove, particularly in this world of re-looking at government finances, that it is a thing absolutely worth doing. But I absolutely believe 100% it is. And as I say, on the back of what we've achieved with sheep so far, definitely.
Well, as a little follow-up to that, there's a lot of talk about public good, and rightly so. I'm all in favour. So aside from minding our carbon footprint and trying to improve our productivity, I think the next big thing for us to look at as an industry in terms of public good is antibiotic use.
Yep.
And I would wonder if, whilst you're rewriting your case, there is an argument to be had where our on-farm medical records should actually be tied to our drug purchase records. Because I think there's an awful lot of drugs being bought and used and then not recorded not for bad reasons quite often, just because there's a lot of things to do and things get left behind. That if you go and have a look at sort of red tractor inspections, you'll find an awful lot of broken bottles and wastage, which may or may not be entirely accurate. So for public good, if you're going to argue for public good in your role, I would argue that at some point we are going to have to do this. And if now's the time that you're making a new system, now's the time to probably think about including that before it's forced upon us.
Yeah. So our system at the moment on antibiotic use, traditionally we have been recording sales because we've not had a way to look at actual use in animal, to pull that data together. And we need to do that. We need to look at what is actually used. And yeah, you're absolutely right, understand discrepancies and things. You know, sometimes water gets in the bottle and it goes bad and things, but what actually is going on? Because industry and Ruma have done a really good job at, you know, catching the low-hanging fruit and reducing antibiotic use. And it feels like we talk about the next steps and there's more things to do, and there is, but we must reflect, as UK, we've done a really good job so far across all sectors. But the bits still to do are quite hard because it is about reducing disease on farm, it's reducing infection, reducing the need to use antibiotics, and so understanding why are we still using them and the discrepancies between sales and use and things is all really important intelligence to help us do that.
And finally, this is a bit of a wish list throwaway comment. If you consider the number of digits in your cattle ear tag number, and then you consider the number of digits in your EID, and if you're a pedigree breeder, the alphanumeric digits in that, add all those together, my understanding is that gives you an alphanumeric number that is big enough to describe or to number individually every single molecule on the planet. Whilst we're going to go forward and have a change of system, it would be lovely if we had less different sets of numbers.
Yeah.
And just one, even if it's a complicated number,
no,
one would be awesome.
I completely agree. I think we should be able to, the cow that I'm talking about is the same cow that's registered in the herd book. We have one identity for them. The part, sometimes difficulty is transitioning though, because which one do you go with and what do you do about it? You've got to be able to have that continuity of history so that, heaven forbid, if you do need to follow up as a BSE or something in cohorts, you can do that and getting the balance in that. But for me, that would be one of the absolute benefits of LIP, and it is that, you know, it's the same animal and it's the same farm and we all have one unique identifier that we're talking about.
Thanks very much, Ben. I'm conscious that we're sort of running out of time. Does anybody have any? Oh, yeah, go for it.
Thank you. My first part of my question, I think, would be addressed to Christine. Why don't you make greater use of the statutory powers that you have or could easily obtain? I mean, if I make a general point, health plans have been enormously successful and have advanced, I think you would admit, have advanced the industry enormously. But not everyone has got a health plan. And I do believe that you would get a fairly favourable sort of reaction to that sort of proposal. And if you look at some of your BVD, for example, I mean, you've said yourselves that BVD could be conquered if everybody did their bit. But goodness, we've got PIs still roaming about farms, and you know, you don't appear to want to do anything about that. And I go back. I'm old enough to go back to sheep scab. Sheep scab was a real disaster, but you came up. The powers that be at the time came up with a statutory scheme, and within a few months, a couple of years, sheep scab was eradicated. So, have we learned nothing from history?
Thanks for that, and I know you're a great, I've heard you speak before, Mr. Cameron, a great proponent of health plans for farmers. They're not yet statutory in England, neither is BVD, but as we've discussed, that might be something. If industry are all supportive of it and we have that good initial uptake that we will look at doing, certainly in terms of BVD, because as I say, for disease control, you need everybody to do it. Health plans are a great thing, but they need not to sit on the shelf. And that's one of the nuts I think we need to crack about it. And that was one of my learnings in Australia, working there, where the industry scheme, there was a requirement in the industry scheme to have health plans, but many of them sat on shelves and weren't actually being used. And that's why I think the conversation with the vet that we're funding through our animal health pathway is really key. It's got to be more than a checklist, and it's got to be what applies to your farm. So as Kate said, 100% biosecurity, when you're going about a daily business with animals and things, is really difficult. You need to know what are your risk pathways and the one that you need to manage, and that's where we need to focus. Making things statutory works in lots of ways, but you've got to keep up the enforcement, and we have struggled with that in lots of ways and resources. And then, like TB, it often tends to make people think it's a government disease and then feel they're being done to and not worked with. And with the pathway and the livestock information, we've tried really hard to do co-design and work with industry, and that's what we want to do for EID, so that we all jointly invest in the outcomes, and it's not just government says we've got to do this. Because, and finally, sorry, I'm going on, but when you make law, you have to, you can't regionalise it. That's the law and applies to everybody that have got those animals or whatever it's applying to. And that's why sometimes it's difficult in animal disease, because you want to tailor it sometimes. You want it to be able to be flexible for this region or this management practice, and legally that's really difficult, so we don't always get it perfect. So lots of really valid things you're saying and lots for us to think about.
Right, thank you very much for the question. Okay, I'm conscious that we've slightly gone over time. Just really to pull this together, I mean, I think it's clear that there are, I know some of the people in this room, there are people who really care about the health of not only their own herd, but the health of herds throughout the country, and the benefits that it can bring. And, I hope that we can all take those messages home. I think that some of the key messages we have had out of today are the confidence of testing, the confidence of the value of that test and being able to test. Particularly, I think we are all looking forward to the electronic database, and I'm from Wales, but it's still the same aspiration there. The sooner we can get these databases online, the better I think we can do for our herds and to continue to improve them. And then obviously we've got biosecurity, and biosecurity is something that underpins all diseases, not just BVD or TB. There's a whole host of others, so there's lots of things there. And perhaps the final word really is, we heard from Sophie Throop from Morrison's this morning, and she showed us a table where they had surveyed consumers who were buying from Morrison's over the last 10 years and what was most important to them. And consistently across the top, number one importance was food safety and traceability. And I think that this plays such a huge part in that. Now, I'm sat here with the panel in front of this fantastic banner by the National Beef Association that's talking about British beef and the value that it gives to the consumer in terms of health and the environment and sustainability. We've got an incredible product here. We've got so many opportunities to continue to improving animal health. And really, it's a congratulations to people who are really making some serious inroads in their herds to make sure that they're doing that as part of our contribution to British beef. So thank you all very much for listening. Thank you very much to the panel. And I'm sure if you want to have a chat with anyone, you can grab them on the way out the door when they're not looking. Okay, thank you very much.